Nice to meet you, everybody. I'm Dr. Nagasao. I am the director of the Department of Plastic Surgery at Kagawa University. I assume you, the viewer of this lecture, are an English-speaking person living in Japan or a nearby country, and that you are considering treatment to correct the shape of your chest. I produced this movie to give you some very important tips in selecting your surgeon. Pectus excavatum is a medical term for congenital deformity of the chest. Pectus excavatum is also commonly called funnel chest. About 2 in 3 patients are male and 1 is female. When you search the internet to find hospitals that can provide treatment for pectus excavatum in Japan, you will probably be surprised because most of the hospitals apply a single surgical technique to all of their pectus excavatum patients, regardless of their age or sex. In particular, most Japanese surgeons only conduct an approach called the Nuss Procedure because it is easy to perform. However, we use different surgical techniques depending upon the structure of each specific patient. In addition to the Nuss Procedure, we use the Ravitch Procedure and also our original procedure. For female patients, we often perform breast augmentation instead of correcting their rib shapes. We believe that surgeons who treat pectus excavatum must have all these techniques at hand and that surgeons shouldn't stick to one single method. This short movie explains why. Currently, the most popular surgical technique used to correct pectus excavatum is the Nuss Procedure, invented by a great American surgeon, Professor Nuss. The essential mechanism of this surgical technique is to correct the sunken shape of the thorax by inserting and later removing metal bars. When we search the internet for the Nuss Procedure, we almost never fail to find pictures like those shown here. This is how the operation is actually conducted. Let me show you some patients whom I treated with the Nuss Procedure. The Nuss Procedure enables us to correct the shape of the thorax with very short incisions. The Nuss Procedure is an excellent surgical method. So, in Japan, most surgeons consider the Nuss Procedure the supreme method for treating pectus excavatum. Nevertheless, I don't agree with the idea of using the Nuss Procedure for all patients, like many surgeons in Japan do. Herein, I explain the reason. First, let's start by examining the basic principle of the Nuss Procedure. Why does the Nuss Procedure work in the first place? The structure of the thorax is shown here. The outer part of the thorax is bone, and the inner part is cartilage. The bone is inflexible. It doesn't change its shape when forces work on it. On the other hand, the cartilage is flexible. The cartilage bends in response to forces. The basic principle of the Nuss Procedure is to correct the shape of the thorax by pushing the chest wall from inside to outside. Only cartilages respond to the force. bones don't respond to forces. Therefore, in the Nuss procedure, only the area marked with yellow matters. So, we produce simulation models taking only the cartilage part into consideration. The front chest wall is first elevated. Then, a correction bar is placed beneath the elevated sternum to hold it in correct position. Please note that this mechanism works because the cartilage bends when it is pulled up. If the cartilages weren't flexible, this method wouldn't work. Costal cartilages present structural differences from patient to patient. The costal cartilages are quite soft in child patients. The Nuss procedure is suited to them. However, adult patients are a different story because their costal cartilages are hard and less flexible. Direct application of the Nuss procedure for these patients is questionable. Let me explain why. This is a simulation model of a thorax with hard costal cartilages. To emphasize the lack of flexibility of the cartilages, they are modeled with wood. It is possible to perform the Nuss procedure under this condition. However, due to the inflexible cartilages, the sternum sags after operation. Therefore, the operation is often ineffective. The elevated sternum tends to go back to its original position and pushes the bar backward. So, intensified stress occurs on the ribs, causing pain. Furthermore, the concavity of the chest recurs a few years after the bars are removed. The condition of the sternum also matters. The sternum is the bone that exists at the center of the rib cage. The structure of the sternum demonstrates age-related differences. Children have segmented sternums. As patients age, the segments gradually unify and eventually became a single plate. These are side views of the sternum. The structural differences between these sternums are very evident. Then, let's move on to how this structural difference affects the surgery. First, let's take a look at what happens when we work on child patients. The segmented structure is modeled. The sternum is elevated and the bar is placed. The Nuss procedure is very easy to perform. On the other hand, for adult cases, the originally segmented sternum has unified and presents a single plate. This situation is modeled as shown in this picture. However, since the sternum is very hard, it tends to sag and presses on the correction bar. Accordingly, intense stress occurs on the ribs and the patient feels pain. Complication is likely to occur in the treatment of adult pectus excavatum patients because of their unified sternums and hardened cartilages. Then, what should we do to avoid complications? First, how might we deal with the problem of hardened cartilages? When costal cartilages are hard, we make slits on them. After the slits are made, the cartilages become more flexible and it becomes easy to elevate the chest. It becomes easy to elevate the chest wall. These figures show slits we have made in our actual operation. We make a small skin incision at the central part of the chest and expose the costal cartilages. Under endoscopic observation, we cut the cartilages. Making slits on cartilages is also effective in reducing pain. In ordinary operations for pectus excavatum, surgeons forcibly elevate the chest wall. Because of the force involved, patients can feel pain after the operation. However, when we make slits on the cartilages, they become flexible, and we can elevate the chest wall with a smaller force. Accordingly, patients feel less pain after the operation. Making slits is also effective to prevent recurrence after bar removal. In the first stage operation, the chest wall is elevated and the chest shape is corrected. However, in some patients, the elevated chest wall sinks again after the correction bars are removed a few years later. This recurrence doesn't occur when we make slits on costal cartilages. Separated cartilage pieces unify in their new position, and the correct shape of the chest wall is maintained even after bar removal. Next, let me move on to how we deal with hardened sternums. We divide the sternum to make it flexible. After division, the sternum acquires flexibility and can be elevated very easily. I want to emphasize the importance of making original operation plans for each specific patient. For instance, please look at these two patients. Their chest shapes look quite similar, so some surgeons may use exactly the same technique for these patients. However, close observation reveals differences. In this patient, the concave part of the thorax mainly consists of cartilages. On the other hand, the concave part of this patient's thorax mainly consists of bone. When the deformed part consists mainly of cartilage, it's easy to correct the deformity with the Nuss procedure. However, when the deformity includes bone, the chest wall presents unevenness after correction. Moreover, intense stress occurs at the points supporting the bar, and the patient may feel much pain. This complication can be prevented by separating the sternum into the normal section and deformed section. Separation mobilizes the deformed part of the sternum. Unevenness doesn't occur. Since the sunken part of the thorax is elevated very easily, intense stress doesn't occur. Accordingly, pain after the operation can be prevented too. This image shows a thorax operated on with the sternum separation technique. Conclusion: though some surgeons rely on a single surgical procedure, it's a problematic attitude because the structure of the thorax differs greatly from patient to patient. Surgeons should have multiple techniques at hand and select one by referring to the condition of each specific patient. Thank you for listening.